Hi, I'm Tracey Brown, the CEO of the American Diabetes Association.
Hi, I'm Mary D. Groot. I'm the 2020 President for Healthcare and Education. I'm an associate professor at Indiana University School of Medicine, and I'm a clinical health psychologist.
We are so excited to be spending time with Dr. Groot today. As always, we made the commitment to bring you the latest, the greatest information, as much useful and helpful information as possible, as we kind of are all navigating this COVID-19 crisis. And I'm really excited to talk to Dr. Groot today because we're actually going to be spending time on mental health and mental well-being. And so we have been sourcing questions from our diabetes community, and I have one specific question here, Dr. Groot, that I wanted to ask. The person says that I'm a very social person, and I thrive on the interaction of people. And now that we're practicing this social distancing, I'm feeling a little anxious, and they said that they would love to hear some recommended steps or things that they can do to help minimize this anxiousness, as well as to stop them from becoming depressed.
Yeah, sure. Well, we're living through an extraordinary time right now. There's more change in every aspect of our lives, right? Kind of from all the small things to all of the big things than any of us have ever experienced before. So the first step really for us to be in thinking about how to cope with what's happening around us right now is to check in with our emotions and to know that it's okay to not feel okay right now. That we may have a whole host of emotions that we're experiencing. Feeling anxious certainly can be one of those because there's a lot of unknowns right now in the world. Whether that's how long we will have a disrupted routine, or financially or politically, all of the changes that we're in the process of experiencing. We may feel frustrated, feeling cooped up, not being able to go out and be social in the way that we have been in the past. So the first step is just really to acknowledge those feelings and to give ourselves permission to have those feelings. The more we try to press emotion down, the more it tends to come out in other forms. And so it's okay to just know that this is really unusual and we're feeling it that way. The second piece is to give ourselves a little compassion, that to know that this too shall pass, but in the meantime, we're going to be really gentle with ourselves and gentle with others as we move through this time. We can also be mindful of how much we're exposing ourselves to different kinds of emotional content. So for some of us, we're knowledge copers. We do best when we know what's happening and we're keeping pace with all of the developments. And this kind of pandemic situation has had developments happening on a daily, sometimes hourly basis. And while that's a good strategy, we want to practice what we already know in diabetes, which is that all things in moderation. And so being mindful that we want to take breaks. We want to take breaks from the news. We want to take breaks from the negative emotions that sometimes come with that news. We want to expose ourselves to positive emotional experiences. We also want to be mindful that even though we may be physically isolated or physically distanced from other people, we're not socially isolated. That in the modern era, we have tools. We have telephones, we have social media, we have ways of connecting with each other. A group of my colleagues here in Indiana organized a Netflix night through one of the Zoom outlets, the conference call type outlet, to be able to share a movie night together. Because that's what people would normally do. So we sometimes we have to be a little creative about some of those ideas, but connecting with each other through safe ways of connecting, whether that's social media or telephones or however we're doing that, that works for us, we can be creative with each other. And then last but not least, I think what's really important is developing new routines. So we've all been taken out of our comfort zones of the regular tempo and pace and routines and behavioral sequences of our lives. So whether that's creating a new workspace at home, or whether that's having much less to do because our work takes place outside the home and we can't do that right now, creating routines that ground us and help us to feel comforted is really important. So eating at regular intervals, sleeping at the same time that we would normally sleep. We may have to do that more mindfully because we don't have deadlines coming up to remind us that we need to go to bed at a certain time, or we need to have regular meals. But that's still very important. It's important for ourselves as adults, and it's also important for children because that helps them get that sense of normalcy as well. So these are some of the strategies that we can use to cope with these pretty unusual times.
Yes, that's fantastic. And so I think we all should apply what Dr. DeGroot has laid out: acceptance, breaks, finding creative ways to connect with each other, whether that's Zoom, Netflix night, or what have you, and then scheduling these, new routines. And so thank you so much, Dr. DeGroot, for spending time with us. Thank you very much.
My pleasure.